Joyce Bethel, I have a cataract. They talking surgery. Cataract, rather. Joyce, cataract surgery now is such a simple procedure. In the good old days, the cataract is when the lens in your eye that's inside your eye becomes opaque and loses. It's normally clear. You can see through it. It changes the shape so that your focal point, so that you can look down and read the newspaper or a book, and you can look up and see distances like street signs, etc. The shape of the lens has muscles on it that changes its shape and focal point. Well, as you get older, sometimes that lens gets cloudy and you can't see through it anymore. So it can start off just as like tunnel vision. And sometimes you're not even aware that your peripheral vision has been compromised so much by the cataract. And sometimes you get almost complete blindness. Well, in the good old days, they take the lens out, they sew your eye up, they give you some. Now you don't have a lens, so you get these big, thick glasses like Mr. Magoo, and you look strange in them. You can't see out of them. It was horrible. Now they literally pop that lens out, tiny incision. They numb your eye, pop the lens out. They pop a new lens in that has been specifically designed to correct your vision to 20/20 instantly. So they pop the old lens out, pop the new lens in. Sometimes they don't even have to sew it up. They just kind of patch you, give you an eye patch. 24 hours later, you have 20/20 vision and your eyes are so clear you look like a teenager. This is amazing because they used to, again, just replace the lenses, then give you glasses to correct the vision. Somebody got smart and say, well, if we're going to put a lens in there, let's put a lens in there that corrects the vision as well. So it's actually, once I get cataracts, and I may already have them, just don't know it. And but my vision is somewhat compromised, just a function of middle-aged diplopia. But I think that as you get that, it's going to be a procedure that I'm not going to hesitate to get. So don't hesitate to get the surgery. Again, it takes literally 30 seconds to do the surgery. They're going to stretch it out to make you think it's worth how much it costs. But most insurances will cover that surgery. And again, it gives you instant vision correction, instant 20/20 vision. They only do one eye at a time because sometimes there are complications and anything can happen. So they don't want to do both and blind you totally. So they'll do one eye, you'll recuperate from that one, then they do the other eye, and you'll have perfect vision. So if that has been what's indicated, then it's time to do it. Because doctors aren't in an urgency. They often tell patients, let's wait until your vision gets to a certain point, then we'll do the surgery. So if you're at that point now, something that I would definitely recommend.